I know cost of living is a problem in America today. We all know that, Mr. President. I like to say when moms and dads go to sleep at night.
$1.2 trillion. That's the estimated amount lost to Medicaid program irregularities over a 10-year period. Not a rounding error, $1 trillion. Welcome to American hearings. Senator Kennedy just took the Senate floor to connect that number directly to kitchen table concerns. Taxes, interest rates, and the cost of simply living in America. And the states he names aren't going to like what he has to say.
I know cost of living is a problem in America today. We all know that, Mr. President. I like to say when moms and dads go to sleep at night and can't, one of the things they're worried about is cost of living. I get that. What could we do to help? Well, obviously one thing we could do would be to lower taxes. We've got to be careful how we do that because we don't want to increase the deficit. We don't want to just borrow money to do that. Another thing we could do to help would be to lower interest rates. If we lowered interest rates, people would pay less interest on their credit cards, on their car loans, on their house notes. Well, what could we do, Mr. President, and you know this, to spend less so we could cut taxes and also lower interest rates? One of the things we could do is stop fraud. One of the things we can do is stop the outrageous fraud in our Medicaid program. Now, look, I want to be very clear here. I'm proud of Medicaid. I mean, I'm proud of the fact that in our country, if you're too poor to be sick, we will pay for your doctor. That's not true in every country, as you know, Mr. President. Some countries, they'll just let you die in a ditch. We don't do that in America. We will pay for your medical care. But that's outrageously expensive. It's okay, money well spent, but it's very, very expensive. And one of the ways we pay for people's care, particularly for low-income Americans, but also now even more so for middle-class Americans since Obamacare passed, is through Medicaid. We spend almost $1 trillion on Medicaid every year. And once again, I'm not speaking against the concept of Medicaid. We don't want people to die in America. It's one of the things that separates us from other people. But we spend almost $1 trillion a year, and the federal government, some people don't know this, pays for 67% of all Medicaid spending. Some people refer to Medicaid as a federal state program, and it is. The state puts up some of the money, but the federal government puts up most of the money. We pay for about 67% of all the spending in Medicaid. And Medicaid keeps going up. I mean, I've seen studies that show it's going up anywhere consistently between 6 and 8% every single year. And when you're spending $1 trillion and it goes up 6 to 8%, you're talking about real money. What we also know is that there is an enormous amount of fraud in Medicaid. I mean, we know that. There are a lot of studies out there, and not everyone can agree on how much, but I have seen studies from reputable think tanks that show that Medicaid fraud, stealing in the Medicaid program, runs between $1.1 and $1.2 trillion over a 10-year period. Can you imagine what we could do to lower interest rates or to reduce taxes if we could save $1.2 trillion on our budget? Now, how does this happen? Well, first of all, why don't the states do a better job of controlling the fraud. And I said, why am I blaming the states? Well, because it's a federal state program, and the feds put up 67% of the money, but the states administer that program. And some states do a pretty good job. Some states do a very good job. Some states are terrible at it. I don't know exactly why that is, but every state, I want to make this clear, has fraud. I saw an audit done by our Inspector General in Louisiana a few years ago, and he talked about the incidence of fraud in the Medicaid program in Louisiana, the people who were getting Medicaid who didn't qualify. And I said, can you send me a list of all the people you found in the Medicaid program who didn't qualify, who were making too much money? I don't want names. I just want the amounts of money that they were making and how long they'd been on Medicaid. And he sent me the list, and if I stacked it up here, I could stand on it and paint the ceiling. I mean, we had people making $150,000, $200,000, $250,000 a year getting Medicaid. Now, that was the state's fault for not checking. Some people say the states don't have any incentive. That's a cynical view. I'd prefer not to believe that's true. But they see Medicaid as free money, since the federal government is picking up most of the tab. I prefer not to think that's true, but it's probably true to some extent. The point is that if our states would do a better job administering the Medicaid program, and stopping the stealing, we could save $1.2 trillion over the next 10 years to help people reach the point where they don't have to sell blood plasma to go to the grocery store. You probably think I'm going to talk about Minnesota, and I'm not. We all know what happened in the Medicaid program in Minnesota. The state of Minnesota basically declared that Medicaid was an open bar. Just come on down, and if you want Medicaid and you want the Medicaid money and you want to steal some, you're welcome to it. I hate to say that, but that's what happened. And I hope every single person who was involved in that stealing up there goes to jail. Every single one. But what I wanted to talk about was, and again, every state has this problem, but some have it worse than others. And one of the ones besides Minnesota that seems to have a problem controlling stealing in the Medicaid program is California. Now, California spends an enormous amount of money on Medicaid. They spend about $220 billion a year. The federal taxpayer puts up $140 billion of that. So the federal taxpayer, the taxpayers who pay money to the federal government put up most of the money. Not all of it, but most of the money. How much does the federal government put up vis-a-vis the state government? Well, in the Obamacare portion of Medicaid, the federal government puts up $9. So for every $1 that the state government puts up for the Medicaid program, the federal government puts up $9. Wow. And some of the public officials in California have started to look at this as free money, just free money. And they don't try to fight the fraud. Now, how do you stop the fraud? One thing a state can do is investigate people who claim they're health care providers. We saw this as a problem in Minnesota. If you claim to be a home health provider, you're supposed to have a minimum level of qualification. If you claim to offer to provide after-school services, you're supposed to have a certain level of qualification. I don't think the state government in California even checks. We've got every fly-by-night artist in America, it seems, going to California to become a health care provider to get some of the money. And a lot of the times when they get that money, the money never makes it to the patient. They steal it. California, for example, has 12% of the population. In the last decade, they have been responsible for 50% of all of the new healthcare providers formed in America. Most of them are social assistance and so-called healthcare establishments. And there's an enormous amount of fraud there. We saw that once again in Minnesota, which has been publicized more, where people say, I'm now a healthcare provider. Give me the money, and so I can help people. And you give this fly-by-night healthcare provider money, and they never help people. So that's one way. The other way that you can control the spending in Medicaid is to be careful about the services you offer. You want to spend the Medicaid money on people who need it. You want to spend the Medicaid money on people who need it because they're sick. That's why we passed Medicaid. But states, once again, administer their own Medicaid programs, and for the most part, they get to decide what services their Medicaid program pays for. Now, supposedly the federal government has to sign off on it. And clearly, we've got to do a better job there, and I'll save that topic for another day. But what got my attention about California, despite the fact that they have thousands and thousands of these fly-by-night so-called healthcare providers who the state government in California happily gives money to, and sometimes some of that money gets to a patient, but most of the time it gets into their pocket. What got my attention was the services that California state government will pay for in its Medicaid program with money from the federal government, which has been provided by the American people. Here's an example. And this came from an article. This isn't my research. This came from an editorial in the Wall Street Journal, a recent editorial. May 16, 2026. In California, under its state government's definition of Medicaid, the California Medicaid program will pay for tribal prayers. The California Medicaid program will pay for exorcisms. The California Medicaid program will pay for herbal medicines. The California Medicaid program will pay for meal deliveries. In some cases, the California Medicaid program will pay for in-home chefs. Thousands of businesses have popped up in California that literally cater to Medicaid patients. The Medicaid program in California will pay for sports club fees. The Medicaid program in California will pay for a gym membership. The Medicaid program in California will actually pay student loans. They do it under the guise of, well, we want to encourage people to become healthcare providers, and they can't do it if they have onerous financial burdens, so we'll pay for their health care. Now, once again, Medicaid is supposed to be for sick people. When you're spending other people's money, it's real easy to expand beyond that. The Medicaid program in California will pay for scooters. I get that. Sometimes that might be necessary. Bicycles, but it'll also pay for music lessons. The Medicaid program in California will also pay for art lessons. This money didn't just fall from heaven. We all thank heaven for it, but it came out of people's pockets. And that's how we end up having $1.2 trillion over a 10-year period stolen from the Medicaid program. Money that was put up by the American people. It happens in every state. Some are worse than others. Minnesota's an example, but so is California. When you're taking American taxpayer dollars and spending them on an exorcism or a gym membership, something's wrong. And if we want to lower the cost of living in America, if we want to be able to find the money to give people a tax break, if we want to lower interest rates in America, one of the easiest, best ways to do it is to try to fight the fraud in our Medicaid program. It's as simple as that. $1.2 trillion over 10 years of fraud. This didn't just happen, Mr. President, as you know. This has been going on for a long, long time. And I want to give credit where credit is due. Dr. Oz, our new CMS director, the Department of Justice, are both working to try to stop this fraud. But it has been there since God was a baby. And it's got to stop now. And that's what I wanted to, and this is, it's out in the open, and this is not something I'm accusing anybody of unfairly, okay? These are just the facts. So with that, Mr. President, I thank you for your attention. I thank Kaylin for her great work, and peace out.
Welcome back to American Hearings. Kennedy opens this address with a cost of living frame, and then makes an argument most politicians won't touch directly. A significant part of the solution isn't new spending or new programs. It's stopping the money that's already walking out the door. The figure he anchors to, $1.2 trillion in Medicaid-related losses over 10 years, is sourced to established research institutions. He places it in context immediately. Savings of that scale, redirected, could meaningfully lower taxes or reduce interest rates for everyday Americans. That direct connection between federal program discipline and personal financial relief is rarely made this explicitly on the Senate floor. The 9-to-1 federal-to-state funding ratio reappears here, and Kennedy uses it to explain the incentive structure. When a state only risks $1 for every 9 it receives, the motivation to scrutinize every claim is structurally weaker. He's not excusing it. He's explaining the system that enables it. The Louisiana Inspector General's story is one of the most grounding moments in the address. Kennedy requested a list of Medicaid recipients who didn't qualify. The stack was tall enough to stand on and paint the ceiling. People earning $150,000 to $250,000 a year, still receiving benefits, unchecked, 4 years. California's portion of the argument is built on publicly sourced data. 12% of the population, 50% of all new so-called healthcare provider registrations over a decade. The services list returns with even more weight in this context. Exorcisms, art lessons, music lessons, gym memberships, student loan repayment, each one a specific decision by a state government to define that service as Medicaid eligible, using predominantly federal dollars. Kennedy closes by crediting the current CMS director and the Department of Justice as active forces in addressing these issues. The problem, he notes clearly, has existed for decades. What changes now is whether the political will exists to treat it as the genuine priority it deserves. The peace out closing on $1 trillion fiscal policy address is pure Kennedy, and somehow, it works every time. Subscribe to American Hearings and share this one widely.